Thank you, Mitt. All right, let's see. First question that we have, and can we go back here? Where am I pointing to? There we go. Health economics, the dental experience. Why is the dental experience interesting? Why is a dentist here talking about drugs to pharma and physicians? Well, very simply, it's the payment modes and the fact that there's a good possibility that the payment modes in the medical field, in the pharma-physician relationship, will change and will more closely approximate the dental model in the future, and that's what I briefly want to talk about. So, when I say that I'm a dentist, what is the first image that you get? And this is something that you can vote for. Is it pain? Is it the whiny drilling noise? Is it the handing over your credit card to the lady at the front desk? Is it the numbed lips that you leave the practice with? Or is it the fact that the dentist is a small businessman / entrepreneur? So let's see what your vote is. Pain and drilling, okay. Well, I've got a lot of convincing to do over here because I only have 27% of you convinced that I'm a small businessman, entrepreneur. In actual fact, dentists, that's what we are. So let's go further. Psychology of practice economics. What is the difference? Not very different. Both physicians and dentists are dealing with patients. The physician bills the government. It's a total third-party situation. The dentist bills the patient. It's a direct situation. Yes, there are insurance companies, but the patient pays directly for the insurance. So there's more of an immediate relationship. And because of that, the physician and the dentist behave differently towards their client base. And the industry deals with the two groups differently. For example, pharma details the physician. There is no order taken, there's no sale made. The dental rep sells to dentists, walks into the office, expects to walk out with a sale, needs to walk out with a sale if they're going to make any money. Then we look at how the physician deals with the patients. They basically dictate to the patient, tell the patients, this is what you have to do, this is how you have to do it. Dentist has to market to the patient, because the dentist is giving mostly elective opportunities to the patient, and there's a lot more choice. The supply of dentists is greater per capita than the supply of physicians. There's an oversupply of dentists, so the dentist has a different role and a different need to create business. So these are some of the psychology differences in practice economics between medicine and dentistry. Physicians are increasingly tempted, because of the current decrease in third-party or indirect billing income, to seek outside sources of income. In other words, direct patient income. Is this a threat or an opportunity for pharma? We have to take a look at the dental model and see how it may apply to future physician-pharma relationships, because this is possibly the direction that this whole situation is going. Now, let's take a look at question 2. Is the physician payment model likely to evolve in the direction of the dental payment model? Here are your 5 choices. See what you think. And let's see what people thought. Well, pretty even distribution. Very likely, or somewhat likely, about, let's see, half of you think in that direction. So this is at least a good basis upon which to go. What is the dentist looking for in the industry-rep relationship? The dentist is looking for innovative clinical procedures, treatment protocols, reliable techniques, technology and materials, reliable information source. Now, if that picture was in the proper place on this presentation, you'd see a little star because there's a caveat with reliable information source. Dentists are also looking for clear and concise instructions. Show me what to do and how to do to make my bottom line better quickly. I don't want to spend a lot of time learning. I want to learn it quickly. And I want affordable costs for the materials and technologies that I have to buy so that I can charge appropriate patient fees and still have something left over for me. So that's what the dentist is looking for. The dental rep, on the other hand, is looking for the time with the dentist or the dental staff. They are looking for the office, the practice that is willing to learn, change, go to new procedures, the chance to educate. And here again, we have that little star for the caveat that I'm going to discuss in a moment. Ideally, for both these groups, the rep and the professional, we're looking for a long-term collaboration. The dental rep, on the other hand, is very obligated to their to their company to have a signed order at the end of that meeting. They need to make a sale. That's what the company survives on, and that's what the rep survives on. So they're expecting to make a sale, unlike the pharma rep. But the pharma rep, in the future, may be required to do that as well. This is going to be a paradigm shift in the way the pharma rep goes into the practice and what they're going to do. Now, there's a tremendous benefit to dentist and dental rep relationship and collaboration. You have local access to innovative clinical procedures fairly quickly. You can educate a whole cadre of professionals rapidly and effectively for effective treatment with reliable techniques and materials. You have well-trained practitioners and affordable patient fees. So this is the result that comes from a well-established relationship between the dentist, the dental rep, and the dental manufacturing and sales company. Now, the caveat that we were talking about was education and marketing. This is a gray area. Where does it begin to be education and cease to be marketing? On the other hand, where does it begin to be marketing and cease to be education? And this is really dependent if you're the one who's doing the technology or information transfer, because the information transfer can be labeled either way. In fact, it can be skewed either way. So this is something we have to be very careful of. It has to be governed by distinct rules, because if we don't have this information transfer, if we call it too much marketing and we tamp down on it, we're not going to have the information transfer that we need to keep the whole industry going, the information transferring and the benefits to the patient. Information, marketing, either way is the key to the dentist's success, and it's the key to the representative success. So this is very important in any major efforts. To dampen the education by calling it marketing is dangerous. And there's always an effort made in that direction by companies that don't have the new products and by people who don't want to see the professionals or the industry succeeding. And that's what we have to be careful of. Current paradigm shifts in dentistry. What's happening today? Insurance is decreasing. Dentists, and this is very similar to the medical model. Dentists are selecting popular direct bill procedures like tooth bleaching, tooth whitening, veneers, and so on. Dental companies tend to focus on their product energy by analyzing the dentist's financial mindset and bottom line. Rather than developing products that they have to create needs for, it's much easier for them to see the perceived needs that exist and to address these needs in the dental profession. So this is focusing the changes that many of the dental manufacturing and development companies are making. Future paradigm shift in dentistry. Insurance companies will change payment parameters using the sustainability argument. And this is going to be applied to any treatment that is popular, that is frequently performed, that they can see a benefit from not paying for, and the same as a government might be inclined to do. Insurance companies can do this and do this, and the future success of the industry in dentistry depends upon identifying the sectors where the dentist and the rep can best and most effectively serve the public demand, because in that fashion they can overcome the problems that are created by the people who want to slow the process down. And over here we have question 3. With respect to new materials and technologies, should dental company representatives lead, nudge, not interact, wait for questions, follow the dentists? And I'll give you a few seconds to vote. I'm glad to see that. The reps and the industry has to lead the professionals, because the professionals are often too deeply buried in daily practice to explore the possibilities that exist, to make themselves aware, and to learn about things. They have to be pushed somewhat. And that is, I guess, the responsibility of the industry and the representatives. When we take a look at the health economics outlook for the future, if the physician group will tend to increase their direct billing practices, the pharma-physician relationship will change. And by examining the experience of the dentist-rep relationships, this may make the transition easier for both the physicians and the pharma industry. Hopefully this has been of interest in transposing some of the experiences that we've had over the last 20, 30 years in dentistry, and may make the direction and the practice in medicine easier. Thank you.